on Indigenous and Northern Affairs. I'd like to start by acknowledging that I am joining you today from the traditional territory of the Haudenosaunee, the Anishinaabe, and Chinantan nations. Pursuant to the order of reference of April 20th, 2020, the committee is meeting for the purpose of receiving evidence concerning matters related to the government's response to the COVID-19 pandemic. Today's meeting is taking place by video conference, and the proceedings will be made available via the House of Commons website. During the meeting, the webcast will always show the person speaking rather than the entirety of the committee. In order to facilitate the work of our interpreters and ensure an orderly meeting, I'd like to outline a few rules. Interpretation in this video conference will work very much like in a regular committee meeting. You have the choice at the bottom of your screen in the center of either the floor, the English, or the French. In order to resolve the sound issues raised in recent virtual committee meetings and ensure clear audio transmission, we ask those who wish to speak during meetings to set your interpretation language as follows. If you're speaking in English, please ensure that you're on the English channel. If speaking in French, please ensure that you are on the French channel. As you are speaking, if you plan to alternate from one language to the other, you'll also need to switch the interpretation channel so that it aligns with the language you are speaking. You may want to allow for a short pause when switching languages. Before speaking, please wait until I recognize you by name. When you are ready to speak, you can either click on the microphone icon to activate your mic, or you can hold down the space bar while you're speaking. When you release the bar, the mic will mute itself, just like a walkie-talkie. A reminder that all comments by members and witnesses should be addressed through the chair. Should members need to request the floor outside of their designated time for questions, they should activate their mic and state that they have a point of order. If a member wishes to intervene on a point of order that has been raised by another member, they should use the raise hand function. And this will signal to the chair your interest to speak. In order to do so, you should click on Participants at the bottom of the screen. A list will pop up, and you will see next to your name that you can click Raise Hand. I'll try to keep my eye on that. When speaking, please speak slowly and clearly. When you are not speaking, your mic should be on mute. The use of headsets is strongly encouraged. If you have earbuds with a microphone, please hold the microphone near your mouth when you are speaking to boost the sound quality for our interpreters. Should any technical challenges arise, for example, in relation to interpretation, or if you're accidentally disconnected, please advise the chair or clerk immediately, and the technical team will work to resolve them. Please note that we may need to suspend during these times, as we need to ensure all members are able to participate fully. Before we get started, can everyone click on their screen in the top right-hand corner and ensure they are on gallery view? With this view, you should be able to see all of the participants in a grid. It will ensure that all video participants can see one another. During the meeting, we will follow the same rules that usually apply to opening statements and the rounds for questioning of witnesses during our regular meetings. Each witness will have up to 5 minutes for an opening statement, followed by our usual rounds of questions from members. And I'd like to welcome now the witnesses of our first panel. We have with us today from the Assembly of First Nations, Quebec-Labrador, Chief Ghislain Picard. First Nations of Quebec and Labrador Health and Social Services Commission, Marjolaine Suey, Director General. And from the Northern Intertribal Health Authority, Tara Campbell, Executive Director. Ms. Suey and Chief Picard, I'm told you'll be sharing your presentation, and so we'll go now. I'll be fairly strict on timing, so we'll have 5 minutes, and I'll give you a 1 minute warning. Similarly with questions, we'll try to stay very tight because of our time constraints. And so now from the First Nations of Ms. Suey and Chief Picard, you may now have 5 minutes for your opening statement. Please go ahead.
Thank you very much, Mr. Chair, and my greetings to all the members of the Standing Committee. Thank you for this opportunity. We'll be making our presentation en français.
Oui.
Je remercie les membres du comité.
I would like to thank the members of the committee for having invited us here to speak to the situation in Quebec with respect to the government's response to COVID-19. In Quebec and across the country, First Nations have to face up to extraordinary challenges. It is not just that in its collective, but also the results. So the First Nations are part of the most vulnerable populations. In the context of this pandemic, we have to face a great deal of difficulty. There are essential care services. Health services are not necessarily available to them because there will be new standards that will be set at different rhythms from the Canadian population. With respect to what we call the first wave, we have done a first evaluation of what the government has.
I'm so sorry. It just
Go
seems
ahead,
that the translation is around the same volume, so it's hard to understand the English.
Mr. Picard, are you on the French or the English or floor button?
Well, I'm sorry. Let me
click
see.
that on the French. You'll be speaking in French. Yeah.
Yes. Is that good enough? I think.
Well, now you need to go in French. Yeah.
Okay. Yeah. Okay. Écoutez,
Listen, I will just try to get back to what I was saying. So first of all, with respect to the assessment, we have consulted our chiefs and our grand chiefs for the regional associations in Quebec. It goes without saying that this is an exceptional situation and it is having a major impact on the population. This is a challenge, though, that is added to what challenges existed before the pandemic itself. The situation was perceived by our instances as being ordinary. In other words, the administration maintained the normal way of approaching things, whether it was good or bad. And there were improvements that were required, but they did not advance. There was a mechanism that was set up for all the instances to come together and to deal with this. The First Nations had to deal with the same type of level of challenge in dealing with the various levels of government. I am going to leave the part that deals with reconciliation of these matters to others. But the challenges are clear. The results are less so. We have to salute the fact that change is in the wind, that they are attempting to make changes for us. And more than ever, there is a priority to protect the health of First Nations. The federal government must do so. It is very important for reconciliation in the political system in Canada with the involvement of the provinces. This is essential for progress at any level with First Nations. Provinces and Quebec have to go beyond their traditional position and assume the responsibilities that they have, but the same has to be done by the federal government. In conclusion, a clear plan is certainly a very good objective. It's a great goal, but that plan has to be developed with the government and the First Nations together. It will be essential for a meeting of the minds to be able to effect the plan that is needed, particularly since there is this second wave that is ahead of us. We have to learn from all the lessons that we have experienced since the onset of this pandemic. Marjolaine.
Thank you, Mr. Picard. Ms. Sui, were you going to add anything? You have less than a minute.
Donc, est-ce que je peux y aller?
Can I go now? All right. Thank you very much. Let's go. Yes. Good afternoon. for the situation in Quebec presently, as of May 20th, we had 45,000 cases of COVID confirmed and some 3,800 deaths, fatalities. So you can see that Quebec is particularly hard hit by COVID-19. There is an impact on the communities, all communities, First Nation communities. We are very well organized, though, and we have set up emergency planning for this instance. And we have 35 cases recorded with 2 fatalities. We have also certain determinants. We want to be able to establish the range of responsibility. We don't know if this is a responsibility that should be borne by the provinces, by our province, or the First Nations communities, or for the residences. So we would like to have a firmer grasp of the numbers of cases and also the monitoring of those cases. We know that
we're beyond our time now. I'm sorry to interrupt. We'll have time to pick up more further comments later, but right now we'll go to our next 5-minute presentation. And I would like to welcome once again to our committee the Northern Intertribal Health Authority representative, the Executive Director, Tara Campbell. Ms. Campbell, you have 5 minutes. Please go ahead.
Hey, good morning, Tanse. Good afternoon, Mr. Chair and committee members. Thank you for the opportunity to participate in this process. I'd like to begin by acknowledging that I'm presenting today from Treaty 6, the traditional territory of the Cree and homelands of the Métis. My name is Tara Campbell. I'm Swampy Cree from Treaty 5 territory in Manitoba. I am the Executive Director of the Northern Intertribal Health Authority, often referred to as NITHA. Since 1998, NITHA has provided third-level support functions that serve to strengthen the First Nations health service delivery model and contributes to the improved health status of First Nation communities. NITHA is governed by a board of chiefs representing the Cree, Dene, and Dakota of our 4 partners, the Prince Albert Grand Council, Meadow Lake Tribal Council, Peter Ballantine Cree Nation, and the Lac La Ronge Indian Band. Combined, they represent 33 First Nation communities in northern Saskatchewan with a population exceeding 55,000. 13 communities provide primary care services, and the remaining provide community health. The 4 partners have functioned under their own respective health transfer agreements for over 20 years. NITHA services include medical health officer, disease surveillance and health status monitoring, communicable disease control, infection prevention, research, policy development, as well as training. We also provide specialized program support in mental health, environmental health, and nursing, just to name a few. Over the years, communities have been impacted by wildfires, floods, and interruptions to critical infrastructure, such as potable water. Such events remind us that increased adequate support is crucial to our communities, as emergency management efforts often sustain major financial and personnel limitations. Due to remoteness and single road access, our communities are at an increased level of vulnerability and inability to respond. Given factors such as overcrowding, limited access to quality healthcare, food security, and potable drinking water, our communities are more susceptible to COVID-19. Some impacts during this pandemic include lack of consultation with First Nations in provincial planning and response, specifically in regards to reopening. The province is moving forward with reopening plans despite the number of cases rising in the north. We are often overlooked or an afterthought in planning. Food security issues resulting from travel restrictions, road closures, and our remoteness. Communication issues linked to language barriers. Adequate resources are needed to support translations. Shortage of supplies, including PPE for healthcare workers and the availability of cleaning supplies. Access to thermometers for clients for the purpose of isolating and screening continue to be in demand. Testing supplies are not readily available. We continue to experience difficulties in obtaining testing swabs through the province, despite having 16 designated testing sites throughout the NITHA communities. We have delays in accessing PPE, On-reserve populations PPE in Saskatchewan are distributed by the province, and unfulfilled requests are then forwarded to the National Emergency Stockpile. Nursing capacity continues to remain a critical issue. Medical transportation as well. The protection of workers and clients while transporting for out-of-community appointments puts them at risk of exposure to COVID-19. Mental health and addictions, ensuring services are available for those in need. We have mitigated some impacts, such as the partners have distributed essential supplies to their on and off reserve members, as well as supporting its communities with surge capacity and food security. NITHA provides translation of public health orders in both Cree and Dene.
1 minute.
We provide third-level nursing staff. We're deployed to communities to support the implementation of voluntary mass testing as part of active case finding and to support shortages in nursing. While there are many areas that need improvement, it is important to note that some positive steps have occurred. We maintain a good relationship with our ISK regional office. As well, we have signed a data sharing agreement with the province to increase the efficiency of the contact investigation process. In closing, it is absolutely critical a path forward is needed to address the realities of overcrowding and historic underfunding of health service and access. It is our hope that this pandemic will elevate these realities and result in more collaboration and support from government in ensuring a seamless health service delivery for Indigenous people. Thank you.
Thank you so much. Exactly on time. And so now we go to a 6-minute round of questioning. In my first round of questioners, I have Mr. Vidal, Mr. Pawlowski, Madame Berube, and Mumalak Kakak. And we'll start for 6 minutes with Mr. Vidal.
Good afternoon, everybody. I want to thank our witnesses for coming today, for sharing your information with us, and just being willing to participate in this committee proceeding. Most of my questions are going to be for Ms. Campbell, as probably most of you are aware, she comes from Northern Saskatchewan, as she identified, and that's actually my riding as well. So I'm going to focus most of my questions in this round on Ms. Campbell. Ms. Campbell, you talked about the data collection right at the end of your remarks there. You talked about sharing data and data collection. This has been an issue that we have been talking about for a few weeks. We were able to talk about it with the national chief, I think it was a couple weeks ago, with some of the national leaders of the Métis people and whatnot. I'm understanding there's been some progress. I heard that from your comments as well. Can you maybe just elaborate a little bit on the importance of improving that data collection and the need for that sharing of data so that the decisions are being made with accurate information and some of those silos and some of those challenges that we find jurisdictionally overcome a little bit when the data is shared, and you can better make decisions on structuring supports and staging that support appropriately?
Okay, so the data sharing agreement that we signed with the province, it's just so that we are able to find contacts faster. As you know, both the on-reserve and the provincial don't always communicate with one another. Like our systems are often different. Yes, we do have difficulties with data sharing with regards to knowing where positive cases are, and when we also I guess provide information as to where the cases are in our communities as well. We often have issues with trying to protect privacy. So that's a lot of issues that we have, because the moment that we say which community it's in, as you know, that obviously will cause issues in particular in any community. Yeah, I don't know if I've answered.
No, that's totally fine. Thank you. Okay. I was probably just kind of getting at that idea of that ISC focuses on the data just on reserve, and this idea of having data and numbers for Indigenous people both on and off reserve seems to be a bit of a challenge in order to structure supports appropriately. So that's totally fair. little bit of a shout out to your organization. We've done some looking at some of the work you've done, and you've done an excellent job at promoting healthy and positive health outcomes for children through some different contests and activities. I think you did a physically active bingo campaign, and there's just some initiatives you've done that looked like they were very effective and maybe a lot of fun at the same time as you reached out to children and whatnot. One of the discussions that we've had over the last few weeks and talking to leadership, especially in Northwest Saskatchewan, was the fact of getting that message across to certain groups of people that it's so important to follow the health advice, to follow the advice of the public health officials on, washing hands, social distancing, taking this seriously so that we don't increase the risk to elders and vulnerable people in our communities in these areas where there is a higher risk. Can you speak to any plans that you've kind of had within your organization that is helping to get that message out to the people that it's so important to take this seriously to protect our elders and the vulnerable people in these communities?
That's a good question. So right now we're actually in the process of starting to do, we do have communities that do promote, for instance, elders saying we are vulnerable and think about us when you go out and whatnot. So we are hoping to do the same for all of the partnership to be able to provide that type of messaging together. As you mentioned, we have been trying to target youth to try and to let them know, this is a serious issue. What happens if those with health issues contract COVID-19, and I guess the importance of overall following the public health measures, and by doing that we can reduce the transmission altogether.
1 minute.
Thank you. So obviously you're well into the journey through this kind of first phase of this pandemic, and I mean you're right in the midst of it, dealing with it on the ground. Maybe just briefly, if you could touch on some of the lessons, and you did a little bit in your presentation, but if you could touch on some of the lessons that have been learned from this first wave as we potentially prepare for a second wave of COVID. Is there some things you've learned as an organization that you would definitely put into practice as we face a potential second wave at some point?
Just 20 seconds. Go ahead.
Okay. Well, one of the things that have been working for our communities is restricting access into their communities. So, like I mentioned earlier, we have 33 communities, and during the height of this, we had 27 of them that restricted road access coming in. So, just that alone helped with stopping transmission.
Thank you very much, Ms. Campbell. Mr. Pawlowski, you have 6 minutes. Please go ahead.
Yes, hello to all the witnesses. All of you can take it easy, other than Chief Picard and Ms. Sui, because I'm gonna grill you too. No, I'm not really, but Chief Picard, am I wrong in saying that there's only 2 Innu communities in the world? One of them is your community, and the other one is Davis Inlet.
Oui, effectivement.
Yes, indeed. Can you hear me? Yes, there are 2 Innu communities, which is a Jajit in Labrador. There are also 9 Innu communities in Quebec. So we're on both sides of the border.
I ask you some specifics about Davis Inlet. I worked there out of Nain for 3 months, and so that was one of the communities I looked after. In these kind of meetings and in Parliament, we talk a lot about generalities, but the devil's always in the detail. Do you know much as to what's happening in Davis Inlet? Can I ask you specifics, or should I keep my questions more general?
Well, listen, as far as general questions, in total, Quebec, Labrador is 43 communities, but I know very well that the recent information I've received about 2 Innu communities in Labrador. The situation there is like anywhere else, anywhere in Canada or Quebec. It's under control. We have road controls as between Ghost Bay and Jihadjit, and the results are very positive, and it stops the transmission of the virus in these northern communities. So if we compare the situation, including the one in Labrador or in Quebec, it's rather positive here, more than elsewhere in Quebec, let's say.
Community. I am familiar with NAN communities because I'm in Thunder Bay, and there's a lot of NAN people in Thunder Bay. So I've been in touch with Chief Fiddler as to what they're doing with their communities. One of the things they did early on was really to try to, as much as possible, stop all non-essential travel back and forth to the communities. Is that the same thing that they've done in your communities?
Yes, the Innu Nation took a position on the Labrador side. It was to stop all Goose Bay Airport operations to avoid bringing in cases within the community. Also, on the Quebec side, some communities are isolated, are only accessible or only fly in or accessible by boat. These communities, actually in Quebec, there are about 30 communities that had controls to prevent in and out access to the communities.
Was the problem as a result of this been, and this isn't just in Indigenous communities, but in all across Canada, that now there seems to be a concern that people aren't getting the medical services, people who have cancer, heart disease, all the other things which are the major killers aren't having their problems addressed because of the fact that nobody wants to go to the hospital because of COVID-19. Everything's been shut down. I know, having worked in Nain and looking after Davis Inlet, these are places that had a lot of medical problems beforehand, never mind COVID-19. So are these medical problems adequately still being addressed given the fact that everything's shut down?
I can let Miss Yu answer your question. Marjolaine?
Bon, désolé.
Sorry about that. On that note, there has been people have been afraid to go to hospitals. In Quebec, however, most communities have a health center or a nursing center that's accessible 24/7, so people can still get some healthcare services. The biggest cases have been with those that go through dialysis. They've had to stay outside of communities to continue their dialysis treatment. In other cases, when it comes to cancers and surgeries, we followed the schedule given by the healthcare system in Quebec. Surgeries have just started again last week. Before that, it was only for emergencies, with levels of emergencies that were mentioned. Some healthcare continued on that side, and now it's starting up again.
Our time for that round. Thanks, Mr. Pawlowski. Thank you, our guest. And now we go to, for 6 minutes, Madame Bérubé. Vous avez la parole.
You have the floor. Thank you, Mr. Chair. Welcome to all witnesses. Here's my question for Mr. Picard. This week on Facebook, I saw a very interesting image that was shared by a advocate for the First Nations. It said that the coronavirus didn't break the system, but revealed that the system was broken. I think it is a good analogy for the problem. We have systematic problem for housing that are very dangerous for transmitting COVID-19. Can you tell us about the needs of the First Nations in Quebec for lodging and for housing, and what can the federal government do to solve this issue? Thank you very much for your question. It's always been in the news. We're not talking about this for the first time. This crisis amplified what's happening in the communities. On one side, there are contradictory messages. We're promoting certain rules like social distancing, the need to wash your hands for 20 seconds. And on the other hand, there's overcrowding in housing. It's very difficult to take into account, to follow these rules in our current circumstances. Tomorrow, we would need to build 8,000 new housing units to meet the needs. We've been talking about this for 20 years. Since 2000, our region's communities have said that there was a housing crisis. For 20 years, we're fighting for changes. In the current context of this crisis, it's even more important to look at the social determinants of health. There's the issue with lodging, housing, and that's at the heart of all this. Thank you, Mr. Picard. Also, the federal government has announced $24,800,000. From this, the chief Perry Bellegarde mentioned that this was a first step. It means that there should be a second step with regards for these support fund for Indigenous communities. I have some questions. Is this amount given fast enough so that communities can spend the money on urgent matters? Without avoiding the question, I will give the floor to Ms. Siwi. With regards to investment made, that's the first wave. However, if we look at the current needs, we were talking about housing earlier. We can't talk about housing without talking about the needed infrastructure. Right now in Quebec, we have 14 nursing homes. Most seniors live with their family. When we talk about confinement measures, that was a problem with COVID-19. Also, there are also conflicts on jurisdiction with regards to funding, whether provincial or federal, from the federal provincial government. In Quebec, it's a big challenge to go through all this. With regards to housing, all temporary housing have been a concern for the communities. A first phase is good, but we need to move ahead with more measures so that we can improve the current situation. Have you had to go through administrative hoops? Yes. There's jurisdictional issues. For example, who is responsible for different things? With regards to public health, the Public Health Act applies here. The provincial government has some responsibilities. In this case, we're in a situation where we're putting people's health at risk because of jurisdictional issues. Do you need more money on top of what was already given, and how much would that be? I can't give you a number today. What was invested up to date in many communities is not enough. I'll give you an example of a federal government investment that was confirmed today. Quebec announced an increase of a salary increase because their system has deficiencies. They didn't have enough essential workers. So we will see what's going on with the federal funding. That happened today for workers in nursing homes and those that help the elderly live in their on their own. Oh,
we'll pick that up later.
Okay.
Thank you very much. We'll go now for a 6-minute round to Ms. Kak. Please go ahead.
Thank you, Chair. I'll be splitting my time with my colleague, Nikki Ashton. Just a quick shout out to the IT team and the translators. I know it's trying to keep up with everything going on is a lot of work, so shout out to everyone. Thank you so much, of course, to all of the witnesses and sharing your wonderful knowledge and your perspectives. My question is for Ms. Campbell. Can you speak, Ms. Campbell, more about the availability of testing and care in the communities that you support? I know there are some concerns about how data is being collected in some communities, how much testing is being done. Could you talk to some of these concerns and how discrimination seems to play a significant part in these decisions being?
Oh, sorry. So one of the things that we have learned is that testing is key. Testing is key to determining, obviously, the cases that are out in the community, but by being able to test and get results sooner, we're able to isolate individuals to make sure that transmission is minimal. We do a lot of testing with respect to the outbreak that was in the La Loche Clearwater area. We had a total of 30 cases there, and right now we only have 9 active cases, and we've tested 147 people there. Again, going door to door and testing individuals. Now, we aren't able to do this in every community, obviously, because testing supplies are limited. We do have a hard time getting these from the province, like as I had mentioned earlier. So the number of tests that we've done doesn't give an accurate reflection on the number of tests that have done on our people in total, just because some of the testing is done off reserve. So again, there's that gap with data sharing that we often come across, as well as like notifying individuals of their test results. We've come into snags with that as well, where data isn't negative results are submitted back to either us or to the communities in a timely manner. So we're working to address that issue as well with respect to testing.
Thank you so much, Ms. Campbell. I'm going to pass it off to Nikki.
Thank you very much, and welcome everybody. I am looking forward to later on in this meeting discussing an important motion that actually is looking at how procurement is taking place for Indigenous communities. Very concerned that a community here in our region, Matthias Colomb Cree Nation, was told that it'd be receiving tents that nobody ever asked for. And so I think this motion is critical in terms of getting to the bottom of what happened. We know that this has already led to a resignation from the Procurement Council, and it's clear to me that people in the community that that I represent deserve answers, and all communities across the region, across the country, as we've heard today, require access to much needed infrastructure that they are asking for right now. I'd like to shift my question and direct it to both Ms. Campbell and Monsieur Picard. We're talking about, you're both talking about northern regions, vulnerable northern regions, and we know that in our regions, a number of them also involve work camps. We know
Ms.
that,
Ashton, could I interrupt? Could you just move your mic back? It's popping a little bit, just a little more distant. That's good. Try that. Thank you.
Perfect.
Sorry.
Yeah, no worries. So I want to move to the question around work camps. So many of our northern region have work camps. We know that the outbreak in La Loche started from somebody who came back from the Curl Lake work camp. Here in our region, there are 4 First Nations that are standing up against the ramping up of production at the Kiosk Manitoba Hydro work camp. Very concerned about this being, they've done everything possible to keep COVID-19 out, but knowing what's happened elsewhere, work camps can be a vector in terms of a spread of COVID-19 affecting the most vulnerable communities. Do you share these concerns coming out of First Nations that work camps can continue to put them at risk during this pandemic?
1 minute. Go ahead.
I do, just because, like you had mentioned, the outbreak in the La Loche area did start with somebody coming from a work camp. I think more has to be done with respect to even limiting travel between the provinces. If individuals work outside, for instance, in Alberta, work camp, they should be given considerations with respect to not attending work or whatnot. We do have Cameco in the northern part of the province who do have camps. They are on minimal staff right now, so I know if they've taken precautions to try and minimize transmission. As well, they provided supports to communities to help combat COVID-19 as well. I know there is stuff being done.
That's at our time right there. Thanks, Ms. Campbell. We're going now to a 5-minute round. My speakers on my list, I have Mr. Viersen, Mr. Batiste, Mr. Zimmer, and Mr. Van Couverden. Mr. Viersen, 5 minutes. Please go ahead.
Thank you, Mr. Chair, and thank you very much to all our guests for appearing with us today. Much appreciated. I'm going to start with Ms. Campbell. Given the fact that everybody is at home right now, everyone's spending a lot more time online, and we know that our children in particular have been spending a lot more time online. But this is increasing the risk of sexual exploitation. Have you as your organization, put in any measures? I heard about the bingo thing a little bit earlier. Have you put any measures in place to help educate our children to stay safe online?
We haven't really talked about that specifically, like the online presence of children, but we do promote using social media, even despite some of our communities not having the greatest internet to begin with. So we try and, spread messages through Facebook or our website, and try and get to as many people as we can. The other thing we try and do is do radio ads as well to promote other things other than electronic use, so to get them out into the community.
Reduce the screen time, yeah.
Yeah.
Has there been any initiatives coming from the federal government around this?
Not that I'm aware of at this moment.
Okay. I'll pursue the same line of questioning with the First Nations of Quebec and Labrador Health and Social Service Commission. Ms. Sui?
Yeah, thank you. I would say, we're very fortunate in Quebec so that we have those regional organizations that are in support of the communities. A lot of those initiatives came from the communities themselves, but also as a regional level. We have the First Nations Education Council who works with schools, but also we have in our own organization a whole support that comes also from for the educators in the daycare. So the same thing with the Institute of Chikapesh, which is supporting the Innu communities. So those organizations have been working very closely with all of the communities in Quebec in terms of providing activities live on Facebook, work activities that people can do, parent activities. We also set up a website specifically on COVID-19 where all of the organizations are, creating tools and links, also some webinars. So many good initiatives that were put in place. And mainly also we created in our website a forum where each community has its place so they can share with other communities all of the good things and good practices that they are in place. And maybe I would end with also we do have a network with First Line Services for prevention services that we are in connection, on a constant basis with those workers at the community level. So I think everybody is working together and making it safer for those families and children.
Thank you. Chief Picard, one of the, I'm sure it's similar in your neck of the woods, where I'm from, most of the First Nations communities have blockaded the roads in and out, and that seems to have worked. However, there are some concerns about inconsistencies in terms of who may travel in and who may travel out. Have you heard anything on that? And how have your communities managed maintaining the blockades on the road so that only those that should be coming in and going out have been coming in and going out?
A minute.
Chief Picard, maybe you have to unmute.
Excusez-moi. Oui.
Oh, I'm sorry. Yes, we've been guided by the public health in Quebec in part, but at the same time, we have been very proactive, and the communities have set guidelines for themselves. 2 weeks ago, I remember there were at least 30 of 43 communities that had these checkpoints controlling access to their communities. And that gives results. That prevents the transmission of the virus. And the Kanesatake community, which is about 40 minutes from Montreal, did exactly the same thing, acted in the same way. And in this case, it involved the Oka Provincial Park. And
we're at time there. Thank you very much. I'm sorry to interrupt, but we need to stay on our time as close as possible. We have another 5-minute question round with Mr. Batiste. Go ahead, please, for 5 minutes.
You're still on mute there, Jamie.
You're on mute. There's something that sounds like a tuning guitar. Does everyone hear that? There's a strange noise that's... I'll start your time again from 0, but there's something strange happening, and you're not tuning your guitar.
It's only in your head, Chair. It's only in your head.
I'm not playing my guitar. They're in the other room, Mr. Chair. I've been consistent with not playing my guitar while on committee. Thank you very much.
5 minutes. Go ahead.
Okay. I would just like to give Ghislaine the opportunity to answer that question by my colleague, Mr. Viersen. I think that's some of the things that we're noticing is that communities are taking jurisdiction to keep their communities safe through the bylaws that are within the Indian Act. How are they able to enforce it? Just continue your thought process on there.
Je pense qu'on est...
Yes, I think, and I don't want to repeat myself here, I think that we are dealing with a reality here that is not like other Quebecers' realities or even other Canadians' realities. I think Mr. Batiste, Ms. Campbell, we understand. I'm sure we would agree. We know our own realities. And I think that the chiefs were faced with a situation where they had no other choice but to make drastic decisions to control the access and egress from there to and from their communities. As was said earlier, of the 30 various communities in Quebec, there were only 2 deaths. And we have had very good results with this type of blockade, with very limited results. So if we had better opportunities, and if we had better tools to work with, just imagine what we could have done given this opportunity.
You also spoke about government and First Nations working together to solve some of these problems. I'm wondering about best practices, but I also want to, reflect on 2 days ago, myself and Lenore Zahn were part of MPs and Chiefs discussion that we had to collaborate and work together. How in this new reality of Zoom and with the Quebec Chiefs, how are the Quebec Chiefs also meeting through Zoom, and are all communities able to access internet and Zoom or web conferencing that helps make these discussions, which we used to have everyone travel, now we're able to just arrange an hour on video conferences. Is this an effective way of communicating, and do you find that it's getting the job done in Quebec?
Well, in 10 days, on June 2nd to the 4th, we're going to have our first official Chiefs Assembly, and that will be held over Zoom. That is the new reality. And I think that we're moving in this direction. This is where we are headed. Nobody can say, not me, not you, can say where we're going or how long it's going to last. It could last a long time, this pandemic, or not. But in July, who knows what could happen? We can't say what will be happening in Halifax in July, what will happen. We don't know. Many conventions have been canceled. Many meetings have been canceled, major ones, because of this. But this is the new way of operating, because we still have challenges. We have many challenges. Housing is a big one for us. So we have to engage with the government in this new reality and this new way of meeting.
Have
1 minute.
Chair?
1 minute.
I wondered if you could speak a little bit about some of the mental health challenges that are going on in Quebec. We always know mental health is an issue in Indigenous communities at regular times, but how about during this COVID? Have you seen an increase in need for mental health services?
Yes, if you allow me to say so, I'm going to give this to Madame Sui to answer.
Things are going, I would say, fairly well. Unfortunately, we did see, 2 murders in the most recent weeks and a couple of suicides as well, which is always unfortunate. But I would say that most communities, have access to mental wellness teams, also interveners and workers. We do have a network in support of those resources. Of course, everybody's tired right now because it's been going on for quite a while. I think, the word is really to keep an eye on that and making sure that there is a safety net for communities. In terms of violence, many people say that there was an increase, or we may expect an increase, but we don't necessarily have the numbers right now.
I'm sorry to interrupt. We're well past time, and we're going to have to suspend our meeting now to prepare for the next hour. And also, I need to get these musical instruments out of my headset. So at this point, I will thank our witnesses, all of you. Thank you so much for the testimony that you brought, which has been captured by our analysts and will appear in our report. And so without my gavel, I'll temporarily suspend this meeting to prepare for the next round. Thank you.
Thank you.
Acting Deputy Chief Medical Officer Dr. Shannon McDonald, and then First Nations Health Council Chief Charlene Billow will join us. Mr. Jock, Dr. Shannon, you will start off with the 5-minute presentation. Please go ahead.
Thank you, and we will briefly summarize, and we had provided a brief document that can provide a greater context, and of course, very interested in the questions. And thank you for the opportunity to speak to you today. And what I would say is that one of the things I want to focus on is that our response to the pandemic is characterized by our partnership with both the federal government and provincial governments. And that further, there are really additional partnerships that exist with each of the 5 regional health authorities within the province of BC. So this, I would say, is a unique situation in Canada for First Nations. And I would say our response and our ability to respond has also benefited from those partnerships and relationships. One of the things I would use as an illustration of that is that as we have moved into the COVID response, one of the innovations that has been developed is the First Nations Virtual Doctor of the Day. And this was done working with the Rural and Remote Coordinating Committee, which is a subcommittee of physicians in BC, with our First Nations Health Authority staff and working in partnerships, and then working with the Ministry of Health in terms of using primary care resources to carry out this important innovation. So this has really enabled us to provide primary care services in contexts where really no longer were physicians able to travel into rural and remote communities. So this is an example of how we've pivoted our services in the midst of COVID response. Similarly, we are doing mental health services, even including traditional healers and other cultural supports through this mechanism. And I would just use as a further example that we have developed partnerships with groups like the Red Cross, which are also part of our readiness and preparation and ability to deploy resources such as volunteers to meet our anticipated surges. So these are some of our partners, and part of the challenges that we work through in our tripartite approach are the PPE issues. Obviously, this is a global issue, but we've been able to develop mechanisms for distribution so that we are covering some of the basic needs. However, I would say that there's much to do on that there's point of care testing, which is evolving under First Nations context, again, to make sure we're covering gaps. And then what I would say is that there are also discussions with the emergency management, and our response is really based on also the relationship to overall emergency management with a specialization in pandemic response on our part. So I just wanted to make some of those general comments and then pass it over to Shannon to talk about our circumstances and our data.
Thanks, Richard. We've been really lucky in our relationship with the provincial health officer in being a full participant in the BC response to COVID. Our province right now is sitting at 2,467 cases as of yesterday and 149 deaths. But for First Nations in BC, the story is actually better. So far, we have had the total of 81 First Nations cases in the province. 41 of those are residents on reserve, and a significant number of those 41 have occurred in 2 cases of wide community transmission. We have only had 9 of over 200 First Nations communities who have had a positive case of COVID in the community. We are also able to monitor the non-resident First Nations people through a First Nations client file. The First Nations client file was created initially in 2010 and allows us to combine the Indian registry plus the provincial registration and premium billing system. So we have a data set that identifies all resident First Nations people in BC and links them to their provincial health number. And we can use that data set to link to a number of provincial data sets, which we have. But in this case, we were able to link to the data set from the Provincial Health Services Authority that registers all of the positive COVID cases in the province.
Dr. McDonald, we're at time right there. Please keep those further thoughts on hand, and I'm sure we'll come back to it. We have First Nations Health Council Chief Charlene Belleau. Please go ahead for 5 minutes.
Thank you. My name is Charlene Belleau. I'm chair of the First Nations Health Council. The Health Council representative body is 15 appointed members from the 5 health regions throughout the province. Our mandate is to advocate on behalf of BC First Nations in the area of health and to make progress on the social determinants of health. The First Nations Health Council supports the First Nations Health Authority in this work through advocacy with partners. We've established tables with federal and provincial and deputy ministers. As chair, I advocate through direct phone calls and meetings with the Premier of BC, various ministers, as well as Regional Director of Indigenous Services Canada. We also have coordinated our respective COVID efforts with First Nations Leadership Council in BC. Through our advocacy work, we've elevated several issues to the attention of BC and Canada. These include the following challenges that leaders identified. There were challenges around engaging and informing chiefs of positive cases in their community so they could mitigate and manage further spread of COVID-19, impacting elders and citizens. An example of this is where a federal inmate was released, tested positive, and made contact with families and communities. As the Health Council representative and chair, we successfully advocated for First Nations Health Authority to work with key provincial partners, such as the Provincial Health Officer, Dr. Bonnie Henry, for changes to COVID-19 processes for notification to the chief, to the health director, and regional First Nations health officials. The First Nations Health Authority, Corrections Service Canada, and the province of BC developed a notification pathway after this incident. We need to ensure that First Nations interests are addressed in the development of these agreements. Nations and the communities do not have access to adequate Indigenous Service Canada financial resources for security costs associated with mitigating the spread of COVID-19. First Nations have been referred back and forth between ISC and Emergency Management BC. It wasn't clear who was responsible for these additional costs. ISC cannot rely on First Nations utilizing our own resource revenue as a means of protecting our communities. The federal and provincial governments need to address issues and concerns identified in the previous 2017 wildfires and other flooding incidents so that we're not constantly responding from a position of crisis. During the pandemic, when communication and connection are so critical, many of our First Nations do not have connectivity. This must be addressed as a priority. A key principle is that no one is left behind, especially during this time of crisis. We've been strong advocates for family members living off reserve. We've advocated that any available off reserve resources be provided directly to our nations. We know our members and can support them. The Health Council did presentations to the Murdered Missing Women's Commission of Inquiry and provided recommendations that would greatly assist us during this pandemic. Violence against Indigenous women is on the rise, and women continue to go missing during the pandemic. Our communities already suffer from a lack of resources for these fleeing violence and need infrastructure for support. We especially need second stage transition houses near our communities where women can stay for as long as they need to, or in a safe and permanent place. Transition housing will save lives. Our Indigenous children and youth are impacted by COVID-19. Timely and definite access to funding under Jordan's principle is critical. COVID-19 has had devastating impacts on the mental health of our youth, families, and our communities. We've initiated and provided culturally appropriate funeral protocols, traditional wellness, and many return to the land activities to address these mental health needs. It's crucial to have adequate supports in place in the event of a second wave. In 2018, the Health Council signed a tripartite MOU on mental health. The MOU pilots a new community-driven, nation-based model of funding mental health services. It supports a broad range to improve mental health and clinical support. The MOU on mental health and social determinants on health focuses on more than short-term improvements. It commits Canada and BC to develop a 10-year strategy on social determinants of health. It also sets the foundation for a more transformative conversation on nation building and empowering BC First Nations to design and deliver work for them. Throughout our work, we've noted that self-determination is a critical determinant of the overall health of our people. When our people have their authority and autonomy recognized and supported with adequate resources by Canada and BC, our health improves. The knowledge exists within our communities. Supporting nation-based health governance will improve the resilience of BC First Nations, support an empowered response to COVID-19, and better health outcomes for all. Thank you again for the opportunity to speak today, and I'm happy to answer any questions.
Thank you very much, Chief. And now we will go to a 6-minute round, starting with Mr. Zimmer. Please.
Thank you, Chair, and thank you, everybody, for coming on the call today. Chief Bello, I just was through your community this week. I drove to Vancouver, had some very important meetings down there. So I always like going through Williams Lake. I have family there still, so it's a great city. But we'll get to the questions. I just wanted to ask you a question specifically. My role as Northern Affairs and Northern Economic Development Agency critic or shadow minister. So my questions are going to be posed around the economic side of where we are with COVID and in the situation that we're in. Many have asked, and I'll even speak to my local community here where the Blueberry Reserve is, and they were struck with a few cases of COVID with a very huge lack of PPE during that crisis. They were left scrambling to places like Walmart to find hand sanitizer, masks, and all kinds of supplies to really address those cases in their community. And it really kind of goes against what has been said about the availability of PPE to our Indigenous communities. And so Chief Bello, I just wanted to ask you a question. Has PPE been readily available for your communities, broadly speaking, in the Williams Lake area and just in the Indigenous communities that you know of?
Thank you for your question. And I know that PPE is an issue for sure, whether it's within our own region here in Williams Lake, but throughout the province as well. But we also recognize the limitations across the country. But we are constantly advocating for PPE, not only for our healthcare providers, but also for our people that are providing security on the lines or band offices.
Sorry to interrupt again, Chief. I'm not getting the French translation. Could Madam Clerk, is there another technical issue from Chief Bellio's microphone? Do we have the French translation clearly from Chief Bellio? I'm not hearing any response, so I've added a minute onto this. I'm sorry, Chief, but we're not getting an answer to my question. I understood that we were having an interruption in the French interpretation, but apparently not. So would you like to continue, or should Mr. Zimmer restate his question?
I'm okay with if he has a response to his question. Then
go ahead.
Here I am.
Yeah, Chief Bello. Just you were saying there's issues with PPE for your frontline workers, especially, and other members of the community that are part of the infrastructure, right? These are folks that have to deal with the public and also are lacking the PPE. We've heard from members in this very committee that have said that all PPE is available to Indigenous communities and it's readily available. Well, we've seen the opposite. Now that said, I guess the next question I would like to pivot to would be to ask you, Chief, because we'd also heard concerns from the previous panel about what this is going to look like in the future, because we've had, up until today, we've had what's behind us, and we can only correct what's in front of us. So, and my concerns, again, as I stated, about the economic effects, and how can we come out of this where our communities are getting back to work, but doing it safely? And how can the community members that are working at the administrative building in Band Council, workers and all the community members that need this PPE, how does that look forward? How can we get to where we need to be? Where do you think we need to be to get our economy going again? Go ahead, Chief.
I think that there are several things that we can do, or I feel that where our communities may be more prepared. I am grateful that in the province of BC we have at least 145 band offices that were closed during the pandemic. Mm-hmm. There were 90 First Nation emergency operations centers operating. We had 53 local state of emergencies. We had 87 communities that self-isolated and went into lockdown. So to me, the communities are well aware, of what COVID-19 is, how it could impact our communities. Thank goodness it hasn't through Dr. McDonald's report. It helps us to prepare for the next round through, again, I think through the looking at opening up the economy. Of course, we're a little afraid for the safety and wellness of our communities.
Absolutely.
But again, I think that the First Nations Health Authority has done what they need to make sure that we have the PPE equipment available to our communities.
Great. Thank you, Chief, for that. And I'd just like to go to, I guess you're Mr. Jock, the First Nations Health Authority. And just another question, kind of goes to the similar question what I asked the Chief about the PPE and the access to it. Are you seeing access to the needed available PPE? And we hear this provincial, federal, jurisdictional, who's in charge of what. Federally, it's a federal responsibility to provide PPE to the Indigenous communities. And it was supposed to be established that way. We're hearing shortages across the board, across Canada. Have you seen that shortage? And I guess, and it doesn't need to be, we don't need to get the politics of it, I guess, but if there is, what needs to be done to reestablish? I think there's a national emergency strategic stockpile that's supposed to provide access to this equipment across Canada. And I guess I would ask, what needs to be done in the future to make that accessibility to the PPE better?
30 seconds. Go ahead, please.
Thank you for your question. And I would say two things. One is that, as Charlene has said, we've made sure that there's a few weeks supply of PPE. So what we've done is developed a system of distribution that makes sure that we can replenish those supplies. But I would not want to say that there's a stockpile or an accumulated surplus. So I think part of what does need to happen is that each region needs to stockpile. And in our case, what we're saying is that each of our subregions within BC also has to have its stockpiles. And as you pointed out, also is available to provide supplies to schools, commercial ventures, and other aspects of everyday operation of communities. So we are developing that, but I think there's a long way to go, no question.
Thank you very much. And we'll move on now for 6 minutes to Mr. Vancouverton.
Hi, everybody, and thank you so much for your testimony, your words of wisdom, and your contributions today. We really appreciate it, and it allows us and enables us to do our work so much better. I have a general question, and I'll allow Mr. Jock, Dr. McDonald, and Chief Bellia to answer as you see fit. Chief Bellia, you've already touched on the subject a little bit, so if you'd like to elaborate a little bit, and that's fine. Perhaps your colleagues will go first so that can hear their takes as well. My question is specific to women, children, and mental health. I'm hoping that you could identify what factors are specifically negatively impacting women and kids and putting them in an incrementally vulnerable position. I would like to say that I applaud and support your advocacy for nation-based health and education governance and self-determination. I think the evidence is very clear that we get better results from the delivery of these programs. But I'd like to hear more about culturally appropriate delivery and maybe identify some partnerships, such as I know of the Indigenous Guardians that I think, I've seen what they do, and I think they do an incredible job ensuring that that relationship with the land is strong. But my question is basically, what can we do better for these vulnerable populations? How can we mitigate the impacts specifically to women and kids in the context of mental health, but certainly in any other health, economic, or sociological concern that your communities or any communities within your jurisdictions might have? I suppose I'd ask Mr. Jock to start.
Yes, thank you. And one of the things that we have observed is that particularly the youth seem to be an important gap that we have identified early on. So I would say that as we look at adolescents and young adults, that's a real area of challenge. And especially in a context where social distance is important, we've observed that this is a real challenging group with our target audience, and we've heard that from communities. What we have done is pivot our mental health programs into virtual approaches, and we have cultural supports and other kinds of supports that are provided now over Zoom and telephone platforms. But there is much more to do, and I would say part of what our physician group has focused on has been sort of tips and comments on parenting, some guidance on how to work with children while they're being homeschooled. So we have done a lot of social marketing, but I'll turn to Shannon for some additional comments.
Thank you, Richard. I think we have to recognize in any discussion about issues with women and children and family violence is that it didn't start with COVID-19. That many of the circumstances, the social determinants of health, issues of poverty, problematic substance use, lack of opportunity have all gathered together. And just as the rest of the country is kind of coming to the point of experiencing things like isolation and lack of services and financial challenge, those are situations that our communities have been experiencing for a long time. So adding the stress of COVID-19 upon that, it's not surprising. It's sad, but not surprising that some of those behaviors have come to the fore. So the kinds of things that we're trying to do, it's very challenging, of course, in this circumstance to have staff travel to community to provide support. So the virtual supports that are made available have had really positive response from community. We also encourage, of course, communities to do the work themselves and to use their time on the land and their traditional practices to support individuals, families, and the community in moving forward in a time of crisis.
Thank you, Dr. McDonald, and perhaps Chief Billa, could I ask if you have any partnerships that we could consider? I'm the Parliamentary Secretary for Youth, among other things, so I get to sit with the Prime Minister's Youth Council often, and we hear from Indigenous youth across the country on that council. But I'd like to hear from you on potential partnerships that we could be fostering to provide better services.
Chief, before you answer, IT, we're still struggling with some technical things, and the translation's not getting through. And IT's asked if you let the microphone go on your headset, and then just speak like that, and see if that solves the problem. There was some issue with translation. Go ahead with your answer to Mr. Vancouverton.
Sorry, Chief, you'll have to unmute your mic.
You're on mute. Unmute your mic.
There you go. Nope.
You can actually hold down your space bar while you talk, and that's the same thing.
You're on mute.
There we go.
Okay, good. Thank you. I think that there are, several partnerships that we can consider. I know that within the province, there are various activities that we're able to do with the Interior Health. The province of BC, we have a memorandum of understanding where we work with the province on various programs and services. the ones that we find a lot of success with are the ones that allow, where they've provided resources for on the land programming and services to our youth. Some of the positive things that have come out of COVID, if they could be positive, is that we've been able to strengthen our families and our communities by returning to gardening, returning to drumming, our ceremonies, and bringing our families back together and keeping them at home away from the addictions and the challenges with drugs. So we've been able to partner. Thank you.
Chief, that worked. So
good. Thank
same
you.
solution for next time. We have either Ms. Berube or Ms. Gill. I'm not sure who's going to speak with the bloc.
Je ne sais pas qui va prendre la parole pour le bloc. I'll be speaking. Chairman, can you hear me? My question is for Madame Bello. We know that Aboriginal, Indigenous women, and we know about the youth's situation, but I would like to hear about your position about the most vulnerable in terms of healthcare delivery. What will be the effect of the pandemic on Indigenous women and children?
Okay, good. I can't get the translation. There were challenges with it earlier.
I believe the translation has been working. Go ahead, and Ms. Gill, you can tell us whether you get it or not.
Okay, I didn't understand her question, though.
Did you not get the translation clearly?
No, it didn't. No, it didn't come through.
Ms. Bello, may I ask you to look at the bottom of your screen? You'll see a participants button and then an interpretation button. If you click on the interpretation button that looks like a globe, you'll see English and French. Please select English, and then you'll be able to hear the interpretation.
Okay, there we go. I pushed English.
Okay. So interpretation again for Ms. Gill. Just restate your question, please.
Madame Berube, pouvez-vous répéter la question?
Can you repeat your question? Madame Berube. No, is it Madame Berube, Madame Gill? It's Madame Berube, not me. Okay, here's my question. We know that women are more susceptible in terms and vulnerable in terms of the pandemic. What must be done to further protect Indigenous women and children from this pandemic?
Okay, can you hear me? Thank you. I know that with us having the opportunity to be able to manage our own health within the province of BC, that we've been able to make sure that our First Nation communities and our nations provide the kind of support that our women need within our homes. I think that, access for sure to appropriate mental health supports, access to other opportunities have been important for the women within our communities, but also our matriarchs are very strong and provide a lot of leadership in a lot of ways to our communities during COVID-19. Were you able to hear that?
Oui, je vous entends.
Yes, I heard you. Yes. I also wanted to ask Madame Bello how the federal and provincial, territorial, and Indigenous governments can ensure that vulnerable people will be protected as we start to loosen the confinement of people. How can we further protect these vulnerable groups?
Thank you for the question. It's been important in BC here for us to partner with the province of BC, where we know that downtown East Side and a lot of the vulnerable people that are in the urban centers, we've partnered with them where they've provided supports to many of our off-reserve members that may be in the urban areas. So to me, that has been really important for our community members. In terms of continuing to protect them, I just think we need to be vigilant as families and as communities and as chiefs of our communities to know where people are and be able to meet them and respond to their needs right in the community, and instead of depending on somebody from outside of the community.
Merci, Madame.
Thank you very much. My question is for Dr. Shannon. According to you, the First Nations communities, do they have sufficient resources to develop and implement their own plan to fight the pandemic?
Merci, Madame.
Thank you. Thank you.
Pandemic plans for some time. Since H1N1, communities, as part of their contribution agreements, were expected to have a plan to respond to a communicable disease emergency. Unfortunately, because there hasn't been urgency over the last few years, that was often not followed up on, and communities were found kind of with an empty basket. Things that they had stored away to stockpile had been utilized in other ways. Individuals who had skills or knowledge had moved on or gotten older. So it has been an exercise in building capacity in community, supporting community-led nursing staff, for example, health directors, leadership, and others to better understand what they were up against, what the battle was, and the decisions that they had to make. They're self-determining nations. My job is to give them the best clinical information to support those decisions, and in my partnership with provincial and regional staff to make sure that there was supports available from the clinical community to make sure that if there was a need, that could be satisfied. We have a very unique situation with our tripartite agreements that have been in place for some time now. And having the First Nations Health Authority to centralize those resources has been very important.
Thank you very much, Dr. McDonald. Our next speaker for 6 minutes is Ms. Kakak. Please go ahead.
Thank you, Chair, and another shout out to the IT team and translation. I know it can be difficult to get us all back on the same page, so shout out to everyone. Thank you all for the witnesses and coming and sharing your wonderful knowledge and participating. Mr. Chair, like everyone else on the committee, I'm very eager to hear from our witnesses today and very thankful. However, we do have one item that I would like to talk to, which I think would be appropriate for us to consider today. During our last meeting, I gave a notice of motion, which I'm hoping to move and vote on today. With the permission of the committee, I'd like to move my motion for debate, and ask that we have a quick vote so that we can move along with our questions. And because I didn't have the opportunity to finish stating my motion last meeting, Mr. Chair, I would like to do that before we proceed.
Please go ahead.
Thank you. That given the recent resignation of Kathy Bennett from the federal government's COVID-19 Supply Council due to a conflict of interest, since she is the chair of the board of Dynamic Air Shelters, a company that currently has a contract with Indigenous Services Canada, the continued lack of transparency for predominantly Indigenous communities with respect to the delivery of supplies and resources from this federal government, the recent procurement of medical tents that were not requested by First Nations, and the presence of corporate lobbyists on the COVID-19 Supply Council, the committee invite the Minister of Indigenous Services and the Minister of Public Service and Procurement to provide testimony about how the federal government will work to improve Indigenous communities' COVID-19 response.
Hello? Mr. Van Couverden?
Thank you, Mr. Chair, and I wish to thank Ms. Kakak for her motion. And while Our side disagrees somewhat with the framing. We strongly agree with the premise and the importance of transparency for Indigenous communities and indeed all Canadians. And with that, in an effort to ensure expediency here, but also to ensure that Indigenous peoples receive everything they need and are entitled to, we support Ms. Kukak's motion in principle, and will support the motion to invite the Ministers of Public Service and Procurement and Indigenous Services to provide testimony to this committee.
So committee, we have the motion. Could I ask if we are all in favor of the motion? Could we put your hand up in front of your screen? I believe we have unanimity. Mr. Vidal, are you in favor of the motion? That's passed. Thank you very much. And you have 3 more minutes, Ms. Kukak.
Fantastic. Thank you so much, everyone. So my next question will be for Chief Bello. Can you talk to us more about the issues around transparency for services being delivered into communities? And do you feel that the federal government is being upfront with resources and services that they are able to provide?
Thank you for your question. I think we could always want more transparency, and we should have transparency, especially during crisis, because the uncertainty creates a lot of challenges for our leaders. In terms of federal resources, I know that currently, at least in British Columbia, we've heard from our chiefs where, because we've been really proactive to protect our communities and our elders, resources around security have not been available or not have the amount of resources needed to properly protect our communities. The food security, for sure, is another issue. I think that, again, we could do a lot more with federal government support around food security. The issue of connectivity, our communities need access to timely and accurate information during COVID-19. And a lot of our communities don't even have access to internet so that they can access the benefits even that are available to them. So I think that there are, a lot of different things that the federal government could improve on so that our communities are not at risk, including the recent release of a federal inmate without proper process in place to protect the communities and our elders.
1 minute.
Thank you so much for that. My next question is for Dr. Jock. Can you talk a little bit about the mental health, access to mental health and culturally appropriate mental health services? Can you talk about some of the barriers and challenges that you see in your position?
Thank you very much. It's Mr. Jock, but thank you. I would say that that generally what we have done through our tripartite arrangement is actually develop more mental health services and mental health action teams that are put in place across the province. Because there's what we took over from the federal government was a system that actually had many gaps, and particularly gaps between the federal and provincial systems. So we have developed a lot of the tools to address the gaps.
We're at time there, Mr. Jock. I'm sorry. We're trying to rush along to get all of our questions in before the round is finished, and so we'll go now to a 5-minute round. I have Mr. Schmale, Ms. Zand, Mr. Vidal, and Ms. Demoff. And Mr. Schmale, 5 minutes. Please go ahead. Mr. Schmale, are you there?
Sorry, Chair. I just had an issue hitting the button there. So thank you very much. I appreciate the testimony from our witnesses today. My question, first of all, is I guess I can open up to whoever wants to respond. But a few weeks ago, we had the AFN National Chief Bellegarde to this committee, and he mentioned that right now policing services on Indigenous communities isn't essential. I think he was referring to a 2019 report by the Canadian, where am I here? It's finding that the jurisdictional ambiguity oh my goodness, my tongue is not, I did my weather report this morning and my tongue is tied, between the federal, provincial, and territorial and Indigenous governments has resulted in the development of a programming and funding approach to policing that neglects to treat policing as an essential service on reserves as it is in non-Indigenous communities across Canada. So I guess my first question is now, with respect to protecting Indigenous communities and enforcing public health measures in a form of a lesson learned perspective, what value would a local policing authority have on preventing the spread of COVID-19, if any?
Charlene, you want to go first?
Sure. Good. Thank you for the question. I regarding the RCMP or any police service, it's really important for our communities during COVID-19. But we've also seen the challenges that they face and the lack of their ability to respond to keep our communities safe. The issue of jurisdiction, is another issue. But we have been able to, within our province, to have our chiefs and our frontline workers set up security checkpoints to keep our communities safe. The RCMP will come around and be a part of what is happening, but that's not good enough. We know that they could play a bigger role. But again, it's something that we need to work on for going forward. There's not just the security issues, but there's the ongoing issues of violence against women where we need them to respond. But again, I'm always afraid that the RCMP, pull off our First Nation officers to other duties instead of responding to our community. So we definitely could do with an improved service from the RCMP or from police services within our respective provinces. It would be really helpful for us.
Okay, does anyone else want to?
The only thing I would add is that many of the public health measures are enforced by bylaw officers. And I would say that that's also something that is not typically in place for First Nations. So there's kind of a double gap there. So I just wanted to add that to Charlene's comments. Shannon, do you have any?
Yeah, it's a legislative gap provincially. Enforcing action under the Public Health Act is not something that police are required to do or mandated to do. And as Richard said, in many places, mandate officers or even environmental health officers end up being the enforcers of those needs. And so the legislative gaps in mandate really get in the way of police taking specific action on public health issues.
Actually, that's a good point. I just want to follow up on that. Is there any data or any experience with those communities who have a Indigenous police service as opposed to one using, say, the RCMP as to the enforcement of those public health measures? As was just mentioned, sometimes they are doing the public health services job. Is there any stories or anything you can provide to the committee about the difference, like I said, with one that has a Indigenous police service as to one that doesn't?
In 30 seconds, please. Thank you.
I would just think that in other provinces, they may have different jurisdictions. I know that in BC, we don't have very many First Nations owned and operated police services. We're serviced mostly by the RCMP. Richard?
Yeah, I just know that you'd have to go to other provinces where they do have their own police forces. And I have seen some of those be quite effective, but it's not really our context here in BC.
And thank you very much. We have Ms. Zan now for 5 minutes.
Thank you very much. And I'd like to share my time with Pam Damoff because we might be running out of time. So first of all, I'd like to say thank you so much to all of the witnesses. Very, very interesting testimony. And I'd just like to ask Chief Bellew a question and say, first of all, that I would very much like to acknowledge your important advocacy work for residential school survivors. Here in Nova Scotia, in the land of the Mi'kmaq, it has been a big problem, as you probably know. And I just want to say thank you, Willalan, from the bottom of my heart for all your work on that terrible, terrible issue. Also mentioning violence against women, the domestic violence rises, all so important, and I don't have time to ask about it, but I do want to ask about addictions and substance abuse, which we know obviously aren't going to disappear overnight just because COVID-19 has come on our horizon. And it's a problem for many Canadians, not just First Nations people. But what is the First Nations Health Council doing in conjunction with the government of British Columbia to address this issue during COVID-19?
I know that through our tripartite agreement, or our mental health MOU agreement, we have joint partnerships with the province to do work on addictions and mental health issues. And Richard would have more detail on some of the specific programs and services through the administration of that and implementation of that agreement. But for sure, the issue of addiction and substance abuse, separate from what happens in the urban areas and away from home community members, it's been a challenge for our community members as we've gone to lockdown. You heard me say earlier that at least 87 of our communities went on lockdown, where those communities, if there are alcohol problems or drug addiction, they've gone through withdrawals. Richard is, again, familiar with some communities where they have had doctors work closely with the communities to help with safe withdrawals. I think all of those are important while we go through COVID-19. Again, it's something we've learned and something that we need to continue to build on before there is a second wave. And again, thank you for your acknowledgement on the residential school work, because it's from that background and history, the lack of trust, but also knowing that we've been able to come together through a settlement agreement, come to the truth and reconciliation and hopes for reconciliation that bring us to today, that make it easier for us to try and have a level of trust that together we'll get through COVID-19. So thank you.
Less than 2 minutes, Ms. Zan. Do you want Ms.
So
Damoff?
could Madam Damoff
Sure.
take the next one? Thank you.
Thanks, Lenore, and welcome. I'm asking questions from the traditional territory of the Mississauga of the Credit First Nation, and I want to thank you for joining us. You've talked a lot about your tripartite agreement, and it's unique in our country. And I had the privilege of meeting you, and you are doing incredible things. Could you maybe explain to us why you are unique and how that has been an advantage during the pandemic, especially, and could serve as a model to be used across the country?
Thank you. And I would start and offer our other witnesses the opportunity to comment as well. But I think part of the opportunity is to make sure that First Nations aren't caught in the jurisdictional gaps. So I would say that's a big change, that actually we're fully ingrained in both the federal and provincial processes. Like I was on daily calls with the CEOs, DMs. Shannon was on the call with the PHO, and on the federal calls, Sonia Isaac-Mann was on the daily ISK calls. So part of what the benefit is, we don't get caught in the same sort of gaps that exist. And I would say we've been able to leverage our opportunities to create new services like primary care, some of the mental health I talked about, but also land-based treatment, significant investments by the province. And in the midst of all of this, we're in an opioid crisis and have been in a mental health crisis, I would say, for many years. So I just wanted to be very brief, but there are many benefits to this agreement and on our approach, and I just wanted to summarize those and give a chance for other witnesses.
Well, that is our time. Thanks, Mr. Jock. Thanks, Pam. And Mr. Vidal, you will conclude this round with 5 minutes. Please go ahead.
Thank you, Mr. Chair. My question, I'm going to allow Mr. Jock to actually carry on with that thought because Ms. Damoff stole my thunder with that question, I think. So I picked up early on in your presentation when you talked about the tripartite partnerships and the successful model and how it's resulted in collaboration, data sharing. I guess maybe just to change the direction of the question a little bit from where you just went in response to Ms. Damoff, is maybe you could talk a little bit about how this came about, how this tripartite agreement came about. You're ending up with great results by the sounds of it, but what could other jurisdictions learn to actually address the things you talked about by tearing down some of those jurisdictional silos and whatnot, and how do they get to there? Or, what was successful in getting you there?
Well, I think it was really tremendous leadership on the part of all three jurisdictions. I think that the First Nations leadership, I would say the first key element was the unity of purpose. The organizations in BC came together and all agreed upon a certain approach, and that unity was really vital to further pursuit. And then I would say the federal government was brought into the picture after Premier Campbell really had a sincere and really big push to reduce the gap in health status. And then it just became really a tripartite partnership, and really various other parties have led at different times and made their contributions. But I would say it was done incrementally through successive agreements, and I would say through developing careful agreements throughout the process.
Is there a particular kind of time in history where you would identify this began? Like, how long is this? I'm trying to get the time frame.
Yeah, I would be pre-Kelowna Accord. So there was a lot of work done at the federal provincial level. Leading up to that, there was a lot of work done by AFN to really bring together those set of opportunities, and that these kind of relationships develop from there. And I would say out of the Kelowna Accord, the relationship agreement that was done by the leadership in BC then set the table for this enterprise, and it was basically a 10-year developmental period. So it, like I said, it was done carefully and without haste, and developing the trust that Charlene was talking about.
Thank you. I appreciate that perspective. I'm going to move on because I'm going to run out of time to another question, and I'll open it up to all three of our witnesses. There's been quite a bit of discussion about pandemic planning and communities having those plans in place relative to those communities that didn't have the plans in place. And so I would frame my question as kind of maybe a two-part question. One, how would you rate the success of those communities that had pandemic plans ready to enact? Sometimes I know it resulted in them having to be dusted off a little bit and pulled off the shelves maybe, but they were there. So how would you rate that kind of comparison? And then secondly, what lessons can we learn to make sure that if we ever face something like this again, that we have effective plans in place for the future?
You want to go ahead, Richard?
Yeah, I think that one of the approaches would be a much more regionalized support for pandemic planning, getting closer to communities and having this a continuous focus. The other thing that's really important is that pandemic planning is also based on effective emergency planning. It's not independent from it. So having effective emergency plans with then those layering of pandemic plans is really key to success. And I would say that we would need to develop capacity, as we mentioned before, stockpiling, preparation, and making sure that we're ready for whatever comes, because these seem to come about every 9 to 10 years. But I would say that generally every one of our communities through their agreements has some form of plan. But obviously every pandemic and every circumstance is different. And even if you have the plan, you'd have to adjust it.
I just wanted to add to Richard's comment where around the pandemic plans, it's been really good over the last few months and certainly over the period of time that we've taken over health for our leaders to make health a priority. So in the province of BC, where our leaders are engaged and really involved in health, it's been really important to this COVID-19 response by the health authority. They know the needs, they express their concerns and work closely with the health authority so that their community concerns are addressed. But again, I think it's our leaders making health a priority. But that comes from a lot of work previously, dealing with residential school, willing to be in charge of our own lives, the self-determination, and how we want to be healthier. It's been really important, I think, for our leaders to be front and center in a lot of that work. And the health authority working closely with the provincial health authorities in conjunction with our communities and our leaders for those plans to be successful. We do have a lot of success stories, I think, within the different regions that the health authority is working in from the pandemic that we can share with one another and
Thanks,
the challenges. Thank you.
Thank you to Chief. Thanks, Dr. McDonald, Mr. Jock. And I can't finish this meeting without telling you on your comment regarding good emergency planning is good planning. When 9/11 happened in New York, the hospitals in Hamilton had been preparing by prearranged agreement to take burn victims. Sadly, there weren't that many because so many perished on the site, but it can be done. And I'm really impressed with all of our witnesses today and our committee. I think we gave a lot of good information for our analysts to analyze and put into a report. And with that, I'll tell you that our next meeting is on Tuesday, May the 26th from 5 to 7 p.m. And this meeting is adjourned.
Thank you.
Don't forget residential.